Menopause explained. What every woman needs to know. She thought she was falling apart. She wasn't. She was in menopause. And nobody told her what that actually means. Narrator. VO. Hot flashes. Brain fog. Mood swings. Weight that won't move. Sleep that doesn't come. If any of that sounds familiar, this video is for you. And if it sounds familiar for someone you love, share it with them. Because menopause affects every single woman on earth, and most of them go through it more confused, more alone, and more undertreated than they should ever have to be. That changes right now. Here's the reality before we go any further. Menopause affects over 1 billion women globally. Every single one of them, regardless of culture, background, or geography, goes through it. And yet more than 80% of women under 40 have either no knowledge or just some knowledge of menopause. Only 34% of women say they've heard about menopause in a medical setting. More women hear about it on social media than from a doctor. That is a failure, and it is one this video is going to start fixing. In the next 10 minutes, we're covering everything. What menopause actually is, the 3 stages, every major symptom and why it happens, the myths that are actively harming women, the treatments that genuinely work, and how to support someone going through it. No fluff, no stigma, just the truth. Section 1. What is menopause? Let's start with the definition, because even the word gets misused. Menopause is not a process. It is a single point in time, the day that marks 12 consecutive months without a menstrual period. On average, it happens at age 52. But here is what most people don't know. The experience of menopause spans a decade or more, because it has 3 distinct stages. Stage 1. Perimenopause. This is the transition phase. It can start in your late 30s or early 40s, sometimes earlier. During perimenopause, the body begins producing less estrogen and progesterone. The decline isn't smooth. Think of it as a roller coaster with spikes and dips, which triggers symptoms like hot flashes and mood swings. This stage can last anywhere from 2 to 10 years. That is not a typo. Up to a decade of hormonal fluctuation, and many women go through it without a diagnosis, without support, and without being told what is happening to their body. Stage 2. Menopause. The single moment, 12 months without a period. The ovaries have stopped releasing eggs. Estrogen and progesterone are at persistently low levels. Stage 3. Postmenopause. Everything that follows. Symptoms often ease, but the hormonal shifts of menopause create lasting changes in bone density, cardiovascular health, and metabolism that require ongoing attention. Understanding which stage you are in changes everything about how you manage it. Section 2. Symptoms. What it actually feels like. More than half of women aged 40 to 64 experience menopausal symptoms including hot flushes, night sweats, palpitations, sexual dysfunction, depression, insomnia, and osteoporosis. But symptoms are not just a list. They are a daily lived experience, and they deserve to be described honestly. Hot flashes and night sweats. A sudden wave of intense heat, face flushing, heart racing, soaking through your clothes at 3 a.m. They are the most common symptom, experienced by the majority of women in menopause. 1 in 3 women experiencing menopause symptoms reports 3 or more hot flashes per day. Not occasionally, 3 times a day, every day. Brain fog and memory slips, forgetting a word mid-sentence. Walking into a room and not knowing why. Feeling mentally slower than you've ever felt. This is real and neurological. Falling estrogen directly affects the neurotransmitter systems supporting memory and cognitive speed. Mood changes. Irritability, anxiety, unexplained sadness, emotional volatility that feels completely out of character. A 2024 systematic review and meta-analysis confirmed elevated risk of depression across menopausal stages. The mood changes are not just stress. They are hormonal, they are real, and they deserve treatment, not dismissal. Sleep disruption. Night sweats interrupt sleep architecture. Falling estrogen reduces REM sleep. Anxiety keeps the brain active. The result is a chronic, compounding sleep deprivation that touches everything: mood, weight, cognition, immunity. Weight and body composition. Visceral fat, the dangerous fat around organs, increases from 5 to 8% of total body fat in premenopause to 15 to 20% in postmenopause. This is not about eating more. It is a hormonal redistribution of body composition that occurs even without lifestyle change. Joint pain, low libido, vaginal dryness. 54% of women experiencing menopause symptoms report that it has impacted their sex life or relationships, including reduced libido, 46%, and vaginal dryness, 35%. These symptoms are real, they are treatable, And every single one deserves to be spoken about openly, not whispered about or endured in silence. Pause right here and ask yourself, how many of these symptoms have you, or someone you know, been told are just part of getting older, or probably stress? They are not. They are menopause, and they have solutions. Section 3. A real story. Consider this story, shared in different forms by thousands of women. Diane was 47. A teacher, calm by nature, but over 6 months, she started waking at 3 a.m. every night, soaked. Started snapping at her kids for no reason. Started forgetting students' names she'd known for years. Started Googling early Alzheimer's because nobody had suggested anything else. Her doctor ran blood work. Everything came back normal. She left the appointment with nothing. It took another 18 months, and a second opinion from a menopause specialist, before someone said the word out loud. Perimenopause. 2 years of disruption. Explained in one word. In one conversation. 45% of women aged 35 to 54 hear about menopause or perimenopause on social media. Only 34% hear about it from a doctor. Diane shouldn't have had to wait. Neither should you. Neither should anyone you love. Section 4. Myths versus facts. Now let's dismantle the myths, because they are directly responsible for women suffering longer than they should. Myth 1. Menopause only happens in your 50s. Fact. Perimenopause can begin in the late 30s or early 40s. Premature menopause, before age 40, affects approximately 1 in 100 women and is frequently undiagnosed. If your periods are changing and you're in your late 30s, menopause is a legitimate clinical consideration. Myth 2. HRT is dangerous and causes cancer. Fact. This myth originated from a 2002 Women's Health Initiative study, but the average participant age was 63 years past menopause onset. Current evidence shows HRT can be a safe and effective treatment for many women, especially when started near the onset of menopause and under medical supervision. MHT, menopausal hormone therapy, effectively reduces vasomotor symptoms by 70 to 90% and preserves bone density, with low-dose transdermal regimens minimizing risks per NAMS and IMS guidelines. The science has moved. The myth has not. Speak to a menopause-informed clinician, not a 2002 headline. Myth 3. Menopause means the end of your sex life. Fact. While hormonal changes can lead to vaginal dryness and lower libido, treatments including HRT, vaginal moisturizers, and lifestyle adjustments can help maintain a fulfilling sex life. Menopause is a transition, not a full stop. Myth 4. Weight gain in menopause is inevitable and permanent. Fact. Neither menopause nor menopause treatments have been shown to directly cause weight gain. The redistribution of body fat is hormonal-driven, but lifestyle intervention, strength training, dietary protein, and in some cases hormonal treatment can meaningfully counteract it. Inevitable is not the same as unmanageable. Myth 5. You just have to put up with it. Fact. There are numerous treatments and lifestyle strategies available. HRT, cognitive behavioral therapy, dietary adjustments, and exercise can all improve symptoms and enhance quality of life. Suffering through menopause without support is not strength. It is a system failure. The tools exist. They should be accessible to every woman. Drop a comment. Which myth have you heard most often? I guarantee you're not alone. Section 5. Treatment options. Let's talk about what actually works, because this is where most conversations end too soon. Option 1. Menopausal hormone therapy, MHT, HRT. MHT provides the most effective relief of vasomotor symptoms and is the first-line treatment for genitourinary syndrome of menopause. It also prevents early postmenopausal bone loss and reduces fractures. Modern HRT comes in multiple forms: pills, patches, gels, sprays, vaginal rings. Transdermal delivery, absorbed through the skin, is increasingly preferred for minimizing cardiovascular and clotting risks compared to oral forms. The key principle from current guidelines: initiation within 10 years of menopause at the lowest effective dose is favored, with periodic reassessment. HRT is not for everyone. Women with certain cancer histories or clotting conditions require careful individual assessment. But for many women, it is the most effective tool available, and the risk conversation deserves to happen with current data, not a 20-year-old fear. For women who cannot or prefer not to use hormones, options include fezolinetant, Veozah, an FDA-approved non-hormonal treatment for hot flashes, gabapentin, and certain antidepressants at low doses, all shown to reduce vasomotor symptoms meaningfully. These are legitimate, effective, evidence-based options, not a compromise. They are appropriate first-line choices for many women. Option 3, lifestyle and behavioral approaches. Cognitive behavioral therapy, CBT, has demonstrated clinically meaningful improvements in hot flash experience, mood, and sleep quality in menopausal women. Exercise, particularly strength training and aerobic activity, directly counteracts visceral fat accumulation, supports bone density, improves sleep, and stabilizes mood through natural dopamine and serotonin pathways. Avoiding alcohol and caffeine can measurably reduce hot flash frequency. A Mediterranean-style diet, rich in phytoestrogens from legumes and whole soy, calcium from dairy or fortified foods, and omega-3s from fatty fish, supports bone health and reduces inflammatory markers that menopause elevates. The most effective approach for most women combines elements from all three tiers, personalized to their health history, symptom severity, and preferences. Not a single prescription, a complete plan. Section 6. How to support someone going through menopause. If someone in your life is navigating menopause, here is what actually helps. Listen without minimizing. It's just hormones is not support. Neither is, every woman goes through it. What you can offer instead is this. I believe you. This sounds really hard. What do you need? Learn the language. Perimenopause, menopause, postmenopause, vasomotor symptoms. When you understand the stages and the vocabulary, you can be a more active advocate in medical appointments, conversations with HR, and difficult moments at home. Encourage a menopause-informed clinician. Not every GP or gynecologist has up-to-date menopause training. Encourage the women in your life to seek practitioners who specifically identify as menopause specialists or who are certified through the Menopause Society or equivalent bodies. At work, advocate for awareness. 64% of women say their workplaces offer no formal benefits or support around menopause. 3 in 4 women aged 40 to 49 report that symptoms have negatively affected at least one aspect of their work life. If you have any influence over workplace culture or HR policy, use it. Menopause is not a personal problem. It is a public health issue. And awareness is where change starts. A message of hope. If you are in the middle of this transition right now, I want to say something directly to you. What you are feeling is real. The fatigue is real. The brain fog is real. The heat at 3 a.m. is real. The mood that doesn't feel like yours is real. And it has a name, a cause, a mechanism, and a treatment. You are not falling apart. You are not imagining things. You are not just stressed. You are navigating one of the most significant biological transitions of your life, and you deserve information, clinical support, and the people around you to understand what that actually means. Working with a clinician trained in menopause can help more than 90% of women feel symptom relief within 2 months. 2 months. That is not distant. That is close. The first step is the conversation, with a doctor, with a specialist, with the person you trust most. This video can be that first step. Share it if it helped. Ask your questions below. You are not navigating this alone. If this video gave you clarity, validation, or one thing you didn't know before, like it. It takes 1 second, and it tells YouTube to show this to more women who need it right now. Subscribe. We cover women's health, hormonal science, and evidence-based wellness every week in exactly this format. Clear, human, judgment-free. Comment below. Tell me, what was the one thing nobody told you about menopause that you wish you'd known sooner? Your answer might be the thing that helps someone else in these comments feel less alone. Share this with your sister, your colleague, your mom, your partner, your daughter. The woman in your life who is quietly going through something she hasn't found the words for yet. This video might be the words she needed. See you in the next one.